The content of this podcast is provided for general informational purposes only and is not intended as, nor should it be considered a substitute for professional medical advice.
Hello, this is Karen Nickel, family nurse practitioner, and you are listening to Itchy and Bitchy, a podcast that provides answers to your many unanswered health questions. I have spoken to many of you listeners out there about the comprehensive online course that I've created to help address the symptoms that so many women experience in their 30s, 40s, and early 50s. I have had so much fun getting to know some of you wonderful people. I would love to have the opportunity to talk to more of you about the course to see if it's the right fit for you. There is a link on our website, itchyandbitchy.com, and our Facebook page, I&B Podcast, where you can schedule an appointment for a Zoom call with me. I know I have said this repeatedly, but again, this is a Zoom call with me. This is not a webinar. So when you make an appointment, I will be sitting at my desk waiting for you to join the one-on-one Zoom call. So, earlier this week, I had something called a retinal migraine. So I thought I would chat with you about this problem. My symptoms began late in the evening with flashing lights along the outside edge of my right eye only, left eye fine. And I also had blurred vision. At first, I thought it was just a weird light reflection off my glasses, but quickly realized that my glasses were not the problem. I have had these before, but it has been years since my last episode. I do not have a headache with the eye symptoms, but because I knew what it was, I took ibuprofen and went to bed because it was actually bedtime. So when I awoke in the morning, I no longer had the flashing lights and blurry vision, but I felt pretty crummy the next day, like most people do following a migraine with headache. Have you ever had symptoms like flashing lights, twinkling lights, and/or temporary vision loss in only one eye? If you have, you may have a type of migraine called a retinal migraine. This is a migraine when you have repeated attacks of visual disturbances that occur in one eye. Based on a study done in 2016, 3 out of 12 people with retinal migraine experience temporary vision loss and/or flashing lights without headache. So 3 out of 12 people do not experience a headache with the retinal migraine, and that is the case for myself. In the medical literature, retinal migraine is described as a rare type of migraine associated with or without headaches and short-term vision loss in one eye. There have been descriptions of the retinal migraine in medical literature since the late 1800s, but the term wasn't coined until 1970, and it was coined by Dr. Desmond Carroll. As I have said about other conditions that are considered rare, it may not be so rare. Rather, it may just be underdiagnosed. I saw this condition in my practice at a frequency that I wouldn't consider rare, but maybe that is due to the fact that my patient population was predominantly females, ages 30 to 80, and it is a condition that is 3 times more likely to occur in women than men. Do you see this as a recurring theme, that we get all these things that men don't get? So interesting. I guess we do escape prostate cancer, but that's about it. Many of you may be familiar with the term ocular migraine, but retinal migraines are no longer called ocular migraines. This name indicates that the problem is with the eye, but in fact, the visual disturbances are coming from the brain. So the medical community no longer refers to a retinal migraine as an ocular migraine, although you will still hear that term for this problem by different medical providers. While the exact cause is still unknown, as with many problems that happen with women, the exact cause is still unknown. Experts now think that retinal migraine episodes result from a wave of reduced nerve cell activity that spreads across your retina, causing the blood vessels to the retina to suddenly narrow, reducing the blood flow to the retina. Afterwards, the blood vessels relax, blood flow resumes, and sight returns. Usually, there are no abnormalities within the eye, and permanent damage to the eye is rare. Retinal migraines are often mistaken for a migraine with visual aura. So some people with migraines have an aura prior to the migraine. So oftentimes a retinal migraine, because it involves a vision, is mistaken for a migraine with a visual aura. The way to tell the difference between the two is retinal migraines happen in one eye only, as was the case for me. It was only in my right eye. My left eye was perfectly fine. And a migraine with visual aura occurs in both eyes. Also, typical migraine with aura is usually still present with the eyes closed. So if you're having these flashing lights, when you close your eyes, you will still see those flashing or twinkling lights. During a retinal migraine, the visual symptoms are not noted when you close your eyes. So you have these flashing lights in the eye, like I did in my right eye, and when I close my eyes, I do not see the flashing lights. In a migraine with visual aura, the visual disturbances tend to go away before the headache begins. Again, usually an aura is something that occurs before the onset of the migraine headache. But those visual disturbances that are a part of the aura can last longer than the visual disturbances we see in a retinal migraine. Also, if the headache occurs in a migraine with aura, it can also be accompanied by symptoms of nausea and severe light sensitivity. In the retinal migraine, the pain, if it happens, tends to be right behind the eye. And with a regular migraine, I shouldn't say regular, there's no regular migraine, but with a migraine with aura, the pain can be spread out in the area behind the eyes, not right behind one eye. A retinal migraine attack starts in one eye and can include something we call scintillations, which are flashing or twinkling lights. Also can involve scotoma, which are areas of decreased or lost vision and or temporary blindness. The visual disturbance usually lasts 5 to 60 minutes. Often this is not accompanied by a headache, but there can be a headache at onset of the symptoms or within an hour after the visual disturbance. It's unusual for an episode of vision loss to last longer than an hour with a retinal migraine. The same eye is usually also affected every time in almost all cases. So every time I would get it, I get the migraine in my right eye. While the exact cause is still unknown, again, experts now think that it's happening because of this decrease in nerve cell activity, which causes constriction of the blood flow in the retina, which triggers the vision problems. So we don't know exactly why that happens in some people, but definitely there are some triggers that seem to be affiliated with a retinal migraine, and I will discuss that right after this break. Welcome back, everyone. So what are the common triggers for a migraine, a retinal migraine? A lot of them are the same as for a migraine with aura, but for a retinal migraine, common triggers include stress, changes in estrogen levels, which maybe was my problem. Maybe my estrogen level dropped, not quite sure. Smoking, that's not my problem. Hot weather, low blood sugar, dehydration, increased altitude, bending over, vigorous exercise, hormonal birth control is a really common cause, high blood pressure, low blood sugar, and red wine. So I know that I wasn't guilty of that either. So there is no cure for retinal migraine. Providers usually recommend taking pain medication like ibuprofen, naproxen, or Tylenol to treat headaches and to avoid your triggers. So that's what I did is I took ibuprofen and just went to bed. But if these aren't enough to effectively manage your migraine episodes, a provider or healthcare professional may recommend preventive medications such as calcium channel blockers. And those are meds that we usually use for either hypertension, high blood pressure, or heart arrhythmias. So retinal migraines tend to be more common in women, in people aged under 40. I definitely don't fall into that category. People with personal or family history of migraines or other headaches, people with an underlying disease such as lupus, atherosclerosis, so artery blockages, sickle cell disease, epilepsy, a disease process called antiphospholipid syndrome, and giant cell arteritis, which is an inflammation of the artery, usually in the temple of the head. So currently, there isn't a test for retinal migraine, so making the diagnosis consists of your provider ruling out other possible primary headache problems and causes for the visual disturbance, including eye diseases. So during the assessment, your provider will review symptoms and personal and family medical history. They'll assess for other potential medical issues, for example, a stroke. There is also something called a retinal stroke, which is not a retinal migraine, but it can cause temporary blindness in one eye. And if secondary causes like stroke are ruled out and your symptoms and timing are consistent with retinal migraines, then the diagnosis can be made for retinal migraines. As one neurologist stated, if an attack of a visual disturbance lasting less than an hour is experienced under the age of 50 by somebody who has no risk factors for other vascular disease, such as high blood pressure, high cholesterol, sleep apnea, family history of stroke, heart disease, then chances are overwhelming that it's going to be a retinal migraine. Treatment is really, again, about avoiding triggers. Certainly, if you are smoking and or taking birth control, hormonal birth control, stopping both are advised. Both of them should be stopped if you are having retinal migraines. If they are occurring on a regular basis, again, calcium channel blockers, which we use to treat high blood pressure or rhythm problems, can be prescribed. My episode this week is the first one I've had in years, so taking a medication with possible side effects just doesn't make sense. So what are the possible complications of retinal migraines? Well, there is a small risk that the reduced blood flow may damage that thin layer at the back of the eye, which we call the retina, and the blood vessels of the retina. So it's possible that the retina itself or the blood vessels in the retina could be damaged. If you have a known diagnosis of retinal migraines, your ophthalmologist or optometrist will monitor this in your follow-up appointments. And the good news is permanent vision loss is rare. However, I cannot stress enough that if you have sudden vision loss that has never happened before, please, please, please make an emergency appointment to see an ophthalmologist or optometrist or report to the emergency department, because if you are experiencing visual problems in just one eye, it could mean that it's caused by different, much more serious medical problems such as stroke or retinal detachment. So I hope you've learned something from my little vision episode I had this week. I thought it would be a good subject for people to learn about if you are not aware of retinal migraines. So I encourage you to visit our Facebook page, INB Podcast, where you can leave comments or questions for me. Our website is itchyandbitchy.com. There are blogs on the site with some of our subjects available for you to read. I have been updating that on a regular basis, so there's some new blogs if you haven't been on the website for a while. On the Facebook page and website, we have the information about how to schedule an appointment with me. This is not a webinar. I'll say one more time. So we can chat about how my perimenopausal course can help you if you are going through this phase of life. As always, thanks to Forrest Wenzel, our producer and composer of our theme music, and the person who does all the behind-the-scenes work to make this podcast happen. Remember that he has an album called An Awful Lot. Go to wherever you stream your favorite music to listen. And if you don't know where, it can be streamed on Apple Music or Spotify. Remember, your health is in your hands. Oh, how I feel. Itchy, bitchy, itchy, bitchy, itchy, bitchy, itchy, and